Hi everyone, welcome back. It's week 7 in our 40-week pregnancy journey, and this week we're talking all about the dreaded nausea and vomiting of pregnancy, and hopefully some tips to help you make it through.
In addition to that, we'll be covering updates from our own pregnancy as part of our in real life discussions.
And giving you updates on what's happening with your baby's development to this point. So just in case you haven't met us before, I'm Kurt, I'm a pediatrician.
I'm Sarah, and I'm an OBGYN.
And we are the Doctors
Bjorkman.
Welcome back everyone. In case you missed last week's episode, we talked all about choosing where to give birth and also how to choose your OB provider. So hopefully this helped as you're making some of these decisions for yourself, and maybe you've even had your own very first confirmation of pregnancy visit since we talked last week. If you missed any of those details of that conversation, go back and check it out.
So, as we said, this is week 7, and we're talking all about the nausea and vomiting of pregnancy and all of the pro tips that we have to hopefully keep this common side effect of pregnancy to a minimum. But before we get into that, here are some updates on your baby's development.
It's week 7, and baby is the size of a blueberry. The arm buds and leg buds continue to grow, the heart keeps on beating, and baby is now even developing eyes and ears.
So while amazing things are happening with your baby, you might not be feeling so amazing yourself. 70 to 85% of women experience some kind of nausea or vomiting in pregnancy, and it can really make your life pretty miserable. Most women start to experience these symptoms between week 4 and 9 of pregnancy, and the good news is that for almost all women, they have resolved by week 16 or so. It is important to remember that if you're experiencing these symptoms, early treatment can help prevent the progression to a more severe form of nausea and vomiting of pregnancy called hyperemesis gravidarum. And there are things you can do from lifestyle modifications as well as medications that can help make this more manageable.
And so almost all women who experience nausea and vomiting in pregnancy start to feel these symptoms before week 9 of pregnancy. So if you start to feel nausea and vomiting for the very first time after week 9, this would be abnormal and a reason to look into other things that could be causing these symptoms. Important things that would go along with non-normal nausea and vomiting in pregnancy would be things like fever, chills, severe abdominal pains, or headache. If you're experiencing any of these with nausea and vomiting for the first time after week 9, please go talk to your OB provider. So let's start a discussion about nausea and vomiting in pregnancy with a little bit about what causes it.
So the exact causes of the nausea and vomiting in the first trimester of pregnancy are not exactly understood. There is a thought that those rising hormone levels are contributing to your symptoms, and that theory is kind of supported by studies that show women with really elevated levels of estrogen are more likely to have symptoms, and decreased levels of estrogen have less symptoms. It's also consistent with women who in the past have taken birth control pills with estrogen and have some nausea when they take those. Those women are also more likely to have nausea and vomiting of pregnancy.
That's really interesting.
Yeah.
There's also some thought that this nausea and vomiting that you experience during pregnancy is protective for you and baby.
Yeah.
So if you can think about it this way, the time in which you're most likely to have this nausea and vomiting is in the first trimester. This is also the time when baby is developing organs and is most vulnerable to insult.
Yeah.
So the fact that you're having nausea and vomiting is going to make you a little bit more selective over the foods and what you put into your body that's protecting you and baby at this time. This may also explain some of your increased sense of smell and your specific food aversions. That is your body's way of protecting you and baby.
Something important for us to mention here is hyperemesis gravidarum. So hyperemesis is severe nausea that leads to persistent vomiting that isn't caused by some other medical condition. With hyperemesis, there are signs of starvation, like ketones in your urine, and a minimum of a 5% of pre-pregnancy weight loss. You may have signs of thyroid, liver, or electrolyte abnormalities, and this is really representing the severe end of the spectrum of nausea and vomiting in pregnancy and only affects up to about 2% of pregnancies. Interestingly, nausea and vomiting of pregnancy is the most common thing women are hospitalized for in the first trimester, and the second most common thing women are hospitalized for in their whole pregnancy. So if your nausea and vomiting is so severe, these are reasons to call your doctor. If you haven't been able to keep anything down for 24 hours, if you notice that your lips, your tongue, or your skin is dry, if you aren't peeing as much as normal, or you've lost more than 5 pounds in 1 to 2 weeks, definitely get in touch with your OB provider. When a woman cannot tolerate liquids without vomiting and is not responding to outpatient management, it is going to be recommended that you go in for evaluation and possible treatment of dehydration and electrolyte imbalances.
Some specific risk factors for nausea and vomiting include things like increased placental mass. So this would be like multiple pregnancies, like twins, triplets, etc., or a molar pregnancy. Also, if you have a history of migraine headaches, history of motion sickness, if you have a family history of hyperemesis in mom or sister, or if you have a personal history of hyperemesis. Another interesting fact is that you're at an increased risk for hyperemesis if you're carrying a female fetus.
So one of the questions I get from moms all the time is, does all of this nausea and vomiting harm my baby?
Yeah. And the short answer is usually no. Mild to moderate amount of vomiting has little effect on pregnancy outcome. In fact, there are some studies to suggest that pregnancies that have nausea and vomiting or even hyperemesis have lower rates of miscarriage.
Yeah.
This potentially suggests a robust and healthy response of the placental hormones that we believe are related to the nausea and vomiting in the first place.
Yeah. Also, no studies have shown an association between hyperemesis and congenital anomalies, and while some studies show a slightly increased risk of a low birth weight infant, some studies do not demonstrate this effect.
So with all of this, the next obvious question becomes, what can you do to limit these symptoms of nausea and vomiting in pregnancy?
Yeah.
And so for this, we're going to group these things that you could do into 2 categories. The first being lifestyle modifications, and the second being medications.
So let's start with lifestyle modifications. Eating small, frequent meals seems to be the key to keeping nausea at bay. Trying to eat every 1 to 2 hours to avoid a full stomach as well as to avoid an empty stomach seems to really be the key. You're going to want to try to avoid eating spicy or fatty foods and try eating dry, bland foods, high protein snacks, or even eating some crackers in the morning before you get out of bed.
Yeah. Interestingly enough, there's a small study that showed meals high in protein are better at alleviating symptoms, more so than meals high in carbohydrates or fats. Some other things you can do is making sure you're well rested as much as you can, and then also avoiding things that you think could be your trigger. Common things could be noise, heat, humidity, or even flickering lights.
Other things you can try to reduce symptoms include ginger or peppermint. Some studies have shown that ginger in its variety of forms can help to reduce nausea, but the studies don't really show that it helps at all with vomiting.
Yeah, and so sucking on peppermint or sipping mint tea may be helpful for you. Yeah. Other women have found that smelling these scents can be helpful, so you could try putting mint oil in a diffuser.
Another non-medical option that has been studied is acupressure, and so some women find helpful to have wristbands that apply pressure to help with the nausea. The data for that isn't great. Some find it helpful.
Yeah. Interestingly enough, there are some studies that have shown that women who have taken prenatal vitamins are less likely to have significant nausea and vomiting in pregnancy. So I know we keep hammering the point about prenatal vitamins, but this is just one more reason why it's great to be taking them.
But on that note, sometimes prenatal vitamins that contain iron can be irritating and cause some nausea. So if you are finding that's happening to you, you may want to try a prenatal vitamin without iron or just take a folic acid supplement for a little while. So overall, I'm feeling pretty good. I noticed that sometimes at night, actually, I get this like almost nausea feeling, and so I eat like a salty snack and it goes away. My favorite this week was Pringles, which I probably haven't had since middle school, so that was funny. I definitely thought the carby snack actually helped more than the protein snack, despite what the studies show. And I definitely found I'm way more sensitive to heat. Like if I get really hot, my stomach starts feeling kind of icky. So I've just been sure to avoid that.
This brings us to medical management of nausea and vomiting in pregnancy. And if you made it to this point where your lifestyle modifications haven't helped you, please, by all means, consult your OB provider.
As we've mentioned before, early treatment of nausea and vomiting of pregnancy is recommended to prevent progression to hyperemesis. Randomized control trials have shown that women who have a history of severe nausea and vomiting of pregnancy in a prior gestation actually do better in their next pregnancy when they initiate anti-nausea therapy before the onset of their symptoms, when you compared it to women who waited to start those anti-nausea meds until they had symptoms.
Yeah. So in other words, if you're having significant nausea and vomiting, don't wait to treat
Get
it.
treatment. Yep.
And so that first line of treatment is actually vitamin B6 or pyridoxine, and this can be given with or without doxalamine. This combination has been shown to be safe and effective for moms, and also in multiple epidemiologic studies has been shown to be safe for baby.
Definitely. There are other medications like Zofran, Raglan, Compazine, and antihistamines, and these can be given IV or dissolve under your tongue, or even can be given as a rectal suppository, and they can significantly help your nausea and vomiting. That being said, they do have some different side effects, so you're going to want to talk with your OB provider about your personal medical history to decide which one is best for you.
And specifically, Raglan, Compazine, and antihistamines have been shown to have no increased risk for birth defects in baby.
Correct.
In Zofran itself, there's been a couple studies that have shown a small increased risk of birth defects. Having said that, other studies have shown no increased risk and that the absolute risk is quite low.
Correct. Remember that all of these medications do have some maternal side effects, so you want to talk with your OB provider about what those are and which one's going to be best for you and how to manage those. So I feel like I've been pretty fortunate in that I have been able to get away with some little lifestyle modifications, but I have had friends who are also OBGYNs who've just been miserable sick and have had to try some of these other things. The ginger, not so helpful. Essential oils, not so helpful. The Zofran is what saved them. And so don't hesitate to talk to your OB about what options are out there and what is safe, because you don't have to be miserable during your pregnancy.
So to sum everything up from this week's episode, the keys to success seem to be stay ahead of your nausea with small, frequent meals.
Definitely. Rest and avoid anything that makes your stomach feel icky, like heat or strong smells.
And if your lifestyle modifications aren't cutting it, don't delay talking to your OB provider about medications or other options that could help.
Absolutely. So that's a wrap on week 7. We hope you enjoyed. Please click subscribe to our channel, leave a comment or a question below, and
we'll see you back next week. Bye, guys. We're doctors.
but not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.